Welcome to First Aid and CPR academic training. Every year, several thousand American workers are injured on the job. Some of the injuries are serious, some are minor. When too much time passes before medical help arrives, a minor injury can become more serious, and a serious injury might become disabling or even fatal. Every adult should know what to do in an emergency before medical help arrives. You hear a loud explosion near your workstation, and a few seconds later, shouting and screaming. You run around the corner into a scene of devastation. Bob holds his face. Blood drips between his fingers. Mariah sits on the floor with what looks like a broken leg. Ed's head pours blood from a long laceration. He seems to be unconscious. Quickly, what do you do first? What is your first step? And who needs your help the most? This course will show you how to approach a problem like this confidently and effectively. This course will not make you a doctor or a paramedic, but first aid training can help you to save lives, reduce recovery time, and possibly make the difference between temporary or lifelong disability for the victim. What is your reaction when you see someone become injured or suddenly ill? Surprisingly, some people are more likely to run away than to help. Perhaps they feel squeamish or think someone else can take care of the problem. Maybe they are afraid of doing the wrong thing. When someone is in trouble, getting involved is the right thing to do, whether you take charge or follow another person's orders and assist as needed. After successfully completing the course, you will be able to describe the 3 S's of first aid, discuss personal liability and Good Samaritan laws, explain universal precautions for blood-borne pathogens. Describe the steps in assessing a scene on victims for appropriate action. Describe the steps in caring for a victim in shock. Describe the steps in caring for bleeding, amputation, and impalement. Describe the steps in caring for burns, including chemical and electrical burns. After successfully completing the course, you will also be able to describe the steps in caring for injuries of the bones, joints, and muscles, describe the steps in caring for seizures and fainting, describe the steps in caring for stroke and heart attack casualties, explain the ABCs of first aid, describe the steps in caring for breathing emergencies, describe the steps necessary to perform CPR, recognize the need for additional training. OSHA requirements for first aid are fairly general and not particularly extensive, but a value of sound first aid training is obvious in their guidelines for first aid training. Click here for information on OSHA's requirements regarding first aid.